care. And with that, in the headlines, the idea of hospice care has become top of mind for a lot of people. But many may not know what that is. And joining us to talk more about that is Dr. Ruma Kumar from Kaiser Permanente, the San Jose Medical Center. Dr. Kumar, thank you so much for sharing some of your time with us this morning and helping to answer some of the questions that a lot of folks may be having this morning. Can you just explain at a base level what hospice care is?
Thank you, James, for having me. Hospice care is truly a specialized type of medical care that's often underutilized, but it focuses on the comfort and support for patients, their families, and their loved ones. And it's for patients that have an incurable illness and have a limited life expectancy, usually 6 months or less. And it's really focusing care on the whole patient, not just the medical aspects of care, but psychosocial care, spiritual care. And it's provided by a team of interdisciplinary team members that can include physicians, nurses, social workers, dietitians, therapists, but also spiritual and community members, homemaker aides, and so forth. So it's really, truly a holistic care of the patient and family members, providing support for them, including bereavement services when the patient passes.
And thank you for explaining that, because that was my next question, is how does it differ from care at a hospital? So if a loved one or if a family member has a loved one that they're thinking might be a candidate for hospice care, how is that evaluated? Is everybody admitted?
So the patient is evaluated by a team of clinicians, and the physician has to determine the life expectancy of the patient. And the care can be provided really anywhere. Most often in California, it's provided in the home, which is a huge benefit for patients and their loved ones. But oftentimes it can also be provided in nursing homes, hospice centers, and rarely in hospital settings as well. And the entire family is also evaluated, the caregiver team for the patient, and there is support provided for those members as well. Again, very holistic care. There are some in-home visits as well. Family members and caregivers are taught what to look for, how to provide care, when to call for help, and that care can be provided 24/7 if there's help needed.
And what you say, a lot of it is here in California done at home. People may be wondering what would happen then if, let's say, the medical condition changes. What if they need more help? How is that handled?
So the team can make home visits and provide crisis care at home. Physicians, nurses, other members of the team can also come out to the home. If there's a need to bring the patient into the hospital, let's say for some respite care for the family members, that can be arranged as well. And obviously, once you plan on taking hospice, that's not permanent. So you can always revoke your hospice benefit and go on to get, further care that you might want that's more aggressive in other places, such as the hospital.
I was thinking of right now, situation with former President Jimmy Carter. We had in that report that he's at home now, surrounded by family and friends as he's in hospice care. That's got to be a huge, I would imagine, a huge benefit of this type of end-of-life plan, to be surrounded by family and friends. It's both obviously helpful for the patient, but for the person who's in care, but also for the family as well, to be there in those final days.
Absolutely, James. That's absolutely right. To have control, to be in an environment that is familiar and loving to you, to be surrounded by those that you love, not limited by visitation hours, to be surrounded by your pets, nature, all of those things that are important to you is the best possible option, I think, for most people, to have that respect, that dignity, that love surrounding you as you traverse your end-of-life journey.
Dr. Kumar, thank you so much for answering those questions, sharing your time, and we really appreciate it.
Thank you so much for having me.
We'll be right back.